Your vitamin D is technically normal. So why are you still tired and moody and always getting sick? I had a patient that she was having chronic fatigue, she was depressed, she had frequent colds, and we did like a simple nutrient panel where we were looking at different vitamin levels. And her vitamin D was 31. That's technically within normal range. But for me, when I'm thinking about functional levels, that's a little bit on the low side. So we decided to optimize it. We increased her vitamin D intake, and then lo and behold, over a matter of time, her energy got better, her immune system was even better. So today I want to talk a little bit about vitamin D, what it does, what it doesn't do, and why it can be beneficial or why you may actually have a deficiency that you're not even realizing. So vitamin D is important for immune modulation. So think less infections, lower risk of even autoimmunity. The other thing is that vitamin D is thought of like a hormone. It works like a hormone where it's regulating calcium levels and how your bones are functioning. And it's also really important for your sex hormones and your thyroid. And when I think about mood and brain function, there's actually really good evidence for vitamin D deficiency and that creating a lot of anxiety and depression. So when I have patients who come to me and they have anxiety and depression and they're on an antidepressant and they're on anti-anxiety medication and nobody has checked their vitamin levels. This feels like such simple, as you call it, low-hanging fruit of something that could actually make a noticeable difference. And it doesn't mean they don't need the anti-anxiety or the antidepressant medication, but it's possible that they could work even better if they were sufficient in their nutrient stores. So when we think about vitamin D, these receptors are actually found on almost every cell in the body. And deficiency has been linked in studies to depression, to infections, to poor bone health. So some of the other things, if you're like, okay, Dr. G, what are some of the other things if I'm deficient in vitamin D that I may actually be noticing? So you could notice a low mood. You can notice irritability. Pretty nonspecific. Brain fog, again, nonspecific. Frequent infections actually could be low vitamin D. So that's people who are getting a lot of colds, they're getting sinusitis, but more than everybody else in their family or people that they're around. If you're getting muscle aches or bone pain or weird kind of like tension in your muscles that is not explained by your activity, that could actually be vitamin D. Patients who have chronic pain can have a vitamin D deficiency and that they can be confused for one another. So if you do have chronic pain and nobody has checked your vitamin D level in God knows how long, please ask your doctor to check your vitamin D level. And I'm going to talk more about what specific vitamin D level needs to be checked. Vitamin D deficiency can also lead to hair thinning, fatigue, or can make you want that feeling of like, I just need more and more and more coffee to kind of get through my day. So the reason why this is like so common, we know we get vitamin D from the sun, right? We know when we go outside, we're exposed to sunlight, it helps our bodies metabolize vitamin D. Sunscreen can inhibit that process. We know that people who are indoors because of winter months, like people who live in the older climates, tend to have lower levels of vitamin D. I used to joke that working in New York and Chicago, I could easily put everybody on vitamin D safely because almost everybody has a vitamin D deficiency. People with darker skin tones can actually synthesize less vitamin D from their skin, which is an important distinction to talk to your patients about. The other thing about low vitamin D is that obesity can actually reduce the availability or the bioavailability of vitamin D, meaning you may need more if you are obese or you're carrying around a little extra weight. And then when I think about vitamin levels, I think about two things. Are you getting enough in your diet, or is it an issue, and is it the issue that it's not actually absorbing? So if you're having symptoms of like IBS, inflammatory bowel disease, like if you have Crohn's disease, or you have ulcerative colitis, or you have a history of celiac, that actually could be impacting your body's ability to absorb vitamin D. When they look at vitamin D across the United States, did you know that 42% of people are considered deficient? And then going along what we were talking about with skin tone, there's even higher number of low vitamin D found in people of color, in the elderly, and those with chronic conditions. Because if you think about it, the elderly and chronic conditions are not going out, they're not going outside. They're not exposed to sunlight. So if you have an elderly person in your life that you love and you want to show them some love, go visit them and sit with them outside for just even 10 to 15 minutes can make all the difference. It can help their moods, it can help their vitamin D levels, and not to mention emotionally, it's really nice to spend time with those elderly people in our lives. If you go to your doctor and they check a vitamin D level, the normal range is from 30 to 100. I don't know about you. To me, that's a very, very wide range. That's a range of 70 points. So when I think about vitamin D, I want that level to be optimized. I don't just want it to be okay. I want it to be great. So my targets for vitamin D are a little bit stricter. I'm looking for a vitamin D level from 50 to 80. So if you're lower than 40, if you're just over the cutoff of 30, I will put you on a vitamin D supplement, especially if I'm seeing you over the summertime where it's likely that it's sunny outside and you're probably higher than you normally are. I'm going to put you on that vitamin D. So, okay, Dr. G, I want to go to my doctor and I want to ask them to test for vitamin D. But you were talking about a specific type of test. So, when they test for vitamin D, they have to test for 25 hydroxy vitamin D. There's this process that goes on where vitamin D has different forms that when the sunlight hits, when it goes through your kidney, it turns into different forms that activate it. So, you need to check 25 hydroxy or OH vitamin D. And when you're supplementing or you're looking at supplements or your doctor puts you on something, vitamin D3 is better than vitamin D2 when we look at absorption rates. So you may be asking, Dr. G, I've seen these supplements of vitamin D where they pair it with K2. What's the evidence for that? And is that something I should think about? So the logic behind pairing K2 with vitamin D is the thought is that it helps to direct your calcium to your bones. And they've actually found in studies that supplemented K2 with vitamin D in postmenopausal females actually improves their arterial stiffness, so the flexibility of their arteries, and also can reduce the calcifications in their arteries in these healthy women who are postmenopausal. So that may be something you want to consider to support your bones and your overall vascular health. So if you can't get your vitamin D levels checked, but you want to start in a supplement, you could start anywhere from 2,000 to 5,000 IUs a day. But I really recommend seeing your doctor, getting those levels checked so you can have a better idea of how much you should actually be taking